Masturbation, an ancient technique if there ever was one, to achieve pleasure at a very low cost. Or maybe the cost isn't so low. Can excessive masturbation harm you? Can it harm your mental or physical health? How much is too much? Does it make you unmotivated? Does it prevent diseases or facilitate them? We see all of this in today's video and with scientific evidence to back it up. Before getting into the possible problems of masturbation, let's look at its proven benefits, because there are some. Firstly, stress relief. Orgasms from masturbation or sex release oxytocin, serotonin, dopamine, and other endorphins, which relax you. They make you feel very good momentarily. Even endogenous endocannabinoids are released, which are closely related to stress management. This relaxing effect lasts up to an hour after orgasm and is undoubtedly healthier than an anxiolytic or alcohol taken for these purposes. Decreased risk of pathologies. We have observational evidence like this 2016 study where it was seen that males who ejaculated more than 21 times a month had a considerably lower risk of prostate cancer than those who only did it between 4 and 7 times a month. In women, masturbation appears to be linked to fewer premenstrual syndrome symptoms and less menstrual pain. Improvement in sleep quality and sleep latency, that is, in the time it takes you to fall asleep, especially when masturbation occurs moments before going to bed. This also occurs with conventional sex. Now, an indirect benefit, because although sexual abstinence increases seminal volume and sperm count, there is recent evidence that tells us it can worsen sperm quality, producing greater fragmentation of the sperm's deoxyribonucleic acid and more mitochondrial damage in it, as you can see in this study. If you're attempting to conceive, it's unwise to abstain from ejaculating for extended periods. Sexual abstinence and semen retention do not increase testosterone or improve long-term athletic performance. Or at least we don't have solid scientific evidence to this day that can confirm this. In fact, the opposite is true. After orgasm, there is a temporary increase in testosterone which shortly afterwards returns to baseline levels. Therefore, abstinence will not make you a better athlete, although in some people it may have behavioral benefits or increased motivation, with little or no evidence of this. Well, we have seen some of the points in favor of masturbation in men and women. Let's now look at some dangerous behaviors around masturbation that can worsen your health. Traumatic masturbation syndrome. Certain masturbation techniques, such as the traumatic masturbation syndrome described by Dr. Lawrence Sank, may be behind problems such as erectile dysfunction and premature ejaculation. In this study, it was seen how those who had atypical behaviors, such as doing it through clothing or in a prone position, that is, face down, had a much higher risk of erectile dysfunction and premature ejaculation. In this case, therefore worsening your sexual health. This point that I'm going to comment on now is key about porn consumption, pornography associated with masturbation. There is an addiction to pornography and it is a growing problem that presents itself in different degrees of intensity. More than 80% of men use porn during masturbation, and about 30% of women according to statistics, which with these issues are usually quite underrepresented. The barriers to access pornography have weakened a lot in recent years. Anyone who has access to the internet has access to it on their mobile. Is this a problem? Well, it can be, especially for teenagers or even preteens who start to have access at a very young age. Anyway, let's discuss adults. Is porn harmful? It varies. Prevalent studies on porn addiction, or as it is known in the scientific literature, problematic use of pornography, are beginning to appear. And it seems that between 5 and 10% of consumers show some degree of problematic use. This can interfere with other areas of your daily life, such as family life, your marriage, or your social life. Being unable to control your consumption and that interference with other important areas of your life are two key points to determine whether we are facing a problem or not. We start to see amotivational syndromes caused by porn. When we watch porn, the brain releases large amounts of the neurotransmitter dopamine involved in the pursuit of pleasurable behaviors. If these spikes of dopamine become very frequent, the basal levels of it decrease. So you will have less interest in other less stimulating elements of your life, such as studying, reading a book, or having a normal relationship with another person, worsening of executive function. When you have a problem related to porn addiction, normal activities like taking the kids to school, making breakfast, or simply picking up clothes appeal to you less and cost you much more. And of course, worsening of sexual life, difficulty in having an erection, decrease in libido, a totally adulterated and far from reality view of what sex is or what to expect from it, which in turn generates fantasies that are hard to replicate and in turn more dissatisfaction. Something similar happens to what happened with ultra-processed foods. When you consume them regularly, real food tastes bland to you. This is similar. If you're interested in learning more, I suggest Gary Wilson's book, Your Brain on Porn. It delves into the issues of porn addiction and overcoming it, which we can further discuss in another video. And finally, we will mention an idiosyncratic style of masturbation. What is this? Certain different atypical styles of masturbation can facilitate problems such as delayed or late ejaculation, a problem contrary to premature ejaculation or even erectile dysfunction. In this study, patients with erectile dysfunction and delayed ejaculation were surveyed about their sexual habits. Very interesting patterns were found. More than a third had a very high masturbation frequency, more than once a day, and many of them had a masturbation technique that is hard to replicate in real sex, whether it's because of the speed, technique, intensity, frequency, whatever. In addition, many found a great disparity between their fantasies and their sexual reality, a point to which pornography contributes enormously, as we have seen. And remember that sometimes an excess of masturbation is just masking a bigger problem in your life, like a depressive state, sky-high anxiety levels, or various problems. When unwell, we often avoid problems. Food is one of the escapes, but so is sex, masturbation, or porn. The problem is that porn is only a temporary relief, and when you finish, you usually feel worse than you did before you started. A totally taboo topic that needs to be put on the table. Tell me in the comments if it has happened to you, because no one here knows you. You must have wondered, how much is too much? Questions to ask yourself are the following. Does masturbation disrupt your daily routine? Do you have to stop working to go to the bathroom to masturbate frequently? Have you stopped making plans you enjoy for this reason? Do you have erectile dysfunction, and does it improve when you stop masturbating so frequently? Does it affect your sexual performance? Is getting or maintaining an erection more challenging? If you answer yes to one or several of these questions, you are probably, in your case, abusing masturbation. If you request a number, there's not much scientific proof available. For most, 3 or 4 times a week is a number that usually doesn't cause any kind of problem, but again, it's something very personal and very individual, and some practical tips that will be very useful to you. Get a checkup and a medical evaluation to rule out hormonal or metabolic problems that may be behind erectile dysfunction. More about these problems in this video. Try a masturbation fast for 2 weeks, just like there is intermittent fasting or dopamine fasting. You can try quitting for 2 weeks and see what changes occur in your body and mind. If your sexual or behavioral performance improves, you were likely overdoing it before. If there's no improvement, search for the issue elsewhere. Eliminate pornography for 2 weeks if you think you have a problematic consumption. Use your imagination, it's there for a reason. Just as I believe that masturbation itself is not the problem in most individuals, I do think that on a population level, pornography is doing more harm than good, especially among the youngest and most susceptible. Eliminating it from your life, or at least reducing its frequency to no more than once or twice a week, will surely bring improvements to your day-to-day life. Decrease the level of stimulation by using only your hands instead of toys or vibrators that end up desensitizing you. Ultimately, as I previously stated, this topic has many parallels with dopamine or ultra-processed foods. It is necessary to reduce the level of stimulation in order to feel normal again. I'm not saying that we have to eliminate any type of toy, any type of aid, but certainly in some people these will do more harm than good. And now I read the comments. Do you think masturbation can become a problem? Do you think pornography can become a problem? I read you carefully. Thanks for sticking around till the video's end. A big hug and keep empowering.